Hello, my name is Dr. Choo Gim Hooi. I'm a cardiologist at Cardiac Vascular Sentral, KL.
Hello, I'm Dr. Ngiu Chai Soon. I'm a practicing gastroenterologist at Cardiovascular Sentral, Kuala Lumpur.
Now, I always get this question from my patients that they do know when their blood pressure is high. They say, doctor, when the pressure is high, I know because I get headaches, I get giddiness, I get neck pain and so on. Well, to the contrary, your blood pressure is actually silent or without symptoms. The only way that you know that you have elevated blood pressure is when you measure the blood pressure. After many years of uncontrolled blood pressure, you're more likely to get stroke, heart failure, kidney failure and various other problems with the vascular tree in the body. So do check your blood pressure and get it treated well if you do have the diagnosis.
As a gastroenterologist in Cardiovascular Sentral, Kuala Lumpur, I do get some of the patients who came to me because of the chest pain. But actually when we look at the patient further, actually the chest pain is actually arising from the gastroesophageal reflux disease, or some of them actually just experience gastritis. So sometimes when you have a stomach attack, actually it can mimic like a heart attack. So you may need to think about things like your stomach or your esophagus.
Many people are actually taking a lot of blood thinners. Some are actual prescription medicine, some are actually supplements or complementary medicine. Some of the more common ones are like garlic, ginger, fish oil, and a lot of my patients take Chinese medicine, tong quai, ginseng, tungsten and all that. We know that many of these supplements do have some blood thinning properties. Well, I must caution that the prescription for blood thinners are for specific reasons. For example, for heart disease patients, we want to prevent the next heart attack, we want to prevent stroke. And these supplements have never been tested for this treatment. And we know that most of the time, or almost always, the lab studies do not show adequate blood thinning effect and the effects may not be sustained. So we do not encourage anyone to replace their needed medicine with some of these supplements as an alternative to the prescribed blood thinner medications.
So there's a few reasons why the stool appears black. Most of the time is because of the pigment that arises from the food that we take. The most common one actually things like dragon fruit. And some medications also have a black substance inside. So some medication called bismuth will also could make your stools black. So what's the situation that whereby you really need to worry about gastrointestinal bleeding when you're passing out a black color stool? So if you notice that you are feeling very unwell, you feel very tired, out of breath, or palpitation, and besides that, you notice that the stool is like watery black color stools, then in this sort of situation, then maybe you do experiencing gastrointestinal bleeding, and your immediate action is not to treat it as diarrhea. You need to go to the hospital immediately to get your blood checked.
Chai Soon, if I may ask you, does drinking coffee make my stool black?
Actually, drinking coffee doesn't make your stool black. You just stain it a bit more brownish or dark brown in color.
Right. I always get this excuse from my patients that I get black stool because of coffee, so it doesn't cause that then.
Yeah.
When we talk about condition called DVT or deep vein thrombosis or venous thromboembolism, we are referring to clots that may form in usually the lower legs, that some of them may go up to the lungs, and this can be life-threatening. The question that sometimes patients ask is, how long do I need to take this medication, the strong blood thinners? Can I stop them once the clot has resolved? Well, please consult your doctor because we need to know the reason why the blood clots form. For example, in patients or people who have gone on a long trip on a plane, they get poor blood flow, they get clots in the leg, or because of certain medications that some ladies who take contraceptive pills can get clots and so on. These are reversible causes. Once the cause of the blood clot is removed and you've treated the blood clots, they are cleared, you may actually stop the medications after 3 to 6 months. There are some people who are prone to get blood clots like genetic problems. Some people who get clots because of cancer disease which will not go away. So some of these patients may actually need lifelong or long-term medications. Please consult your doctor whether you can stop some of your blood thinners. Okay. Alright, Chai Soon, I think that's all the questions that we have today. So thank you everyone.
And stay safe.